Good morning, everyone. We're going to give just a few seconds for everyone to get on and we'll get started. All right. Good morning and welcome to today's Recovery Summit session. This webinar is part of the Recovery Summit series hosted each September by St. Clair County Community Mental Health in recognition of National Recovery Month, a time to celebrate recovery, raise awareness, and highlight the importance of support and connection. A few quick things before we get started. Today's session is being recorded and will be available on the St. Clair County Community Mental Health YouTube channel. Please use the chat box for any questions or comments. Our presenter will address them as time allows. For those requesting continuing education credits, please be sure to remain on the webinar for the full session and complete the survey that will be emailed to you. It's my pleasure to welcome back our presenter today, Maddie Tortomasi. Maddie is the Director of Community Education at Face Addiction Now. Welcome, Maddie.
Hi, thank you. Good morning, everyone. As Chrissy mentioned, my name is Maddie Tortomasi. I'm the Director of Community Education at Face Addiction Now, or formerly known as Families Against Narcotics. But today we're going to be talking about youth substance use, understanding what the new trends are. And I like to say new generations equal new problems because what kids are doing now is completely different than what we've been seeing in the past. Today will be a mix of both national statistics, state statistics, and also just a little bit of like my personal opinion mixed in there as well. So part of our program at FAN, our community education program, is that we go out to schools and do prevention work. And through that, we've learned a lot from what students are actually doing. So I'm going to throw in some tidbits here and there from different stories we've heard of students, and them telling us exactly what's going on in their age demographic, because it is completely different than it's ever been. And so that's kind of goal for today during the hour that I have you. So sorry. So we'll kind of talk about the current trends that are happening, risk and protective factors. What we could do as people who work in this field to help young folks understand what is so dangerous about using substances and what puts them at risk for developing a substance use disorder. And then on the contrary, what helps them prevent a substance use disorder. We'll talk about prevention strategies and supporting working families, because that's really important. And so that's our goals for today. So when we talk about substance use with kids now, like I said, new generations, new problems, and we're seeing new trends. So there is a decline in illicit substance use. So we're not seeing as much, heroin use, as much, cocaine use, if you will, not as much alcohol use as before. But on the contrary, there are availability of stronger substances. So we are seeing, kids who are misusing prescription medication. We are seeing it as an increased potency. There's a lot of synthetic medication out in the streets today, which is kind of shifting how much kids are using versus overdoses versus getting addicted. It's really a combination of factors that is becoming really dangerous because it's all brand new. When we talk about substance use preferences, we're exploring new substances with obviously their synthetic and man-made substances, but also modes of consumption have changed quite a bit versus traditionally, just drinking alcohol or smoking marijuana. It's a lot different now. We are seeing a very big increase in the risk of overdoses for young folks. Overdoses are very high for that young generation. There's a contamination of drug supply. Opioids, we all know, is now fentanyl. Fentanyl being mixed with other types of substances is creating a new problem. And there's not a lot of overdose education for young folks. There's not a lot of education about fentanyl. So that's what we go into schools and talk about: prescription drug misuse, talk about fentanyl, talk about overdoses, because it's really, really important. And then social media. Social media is maybe great on some aspects, but mostly it's doing a lot of harm to our society. But overall, it is really normalizing substance use. When we talk about TikTok or Snapchat, even like Instagram stories, people are using social media to make money and glamorizing substance use. One of the things that I always ask young folks when I'm doing these types of prevention presentations in a classroom is, can one of you name an influencer who just posts about like drinking or using drugs all the time? And they'll just start naming off people left and right. We asked this question from 6th grade all the way to 12th grade. So it really is showing that even at that 6th grade level, they're seeing substances be used and it's becoming normalized from a very young age, just from an online presence. Also, youth are using social media to buy substances. So, people I've seen, even like myself, like, and I'm older generation, I guess you could kind of say. I had seen people like post on Snapchat that they had, marijuana for sale or they had pills for sale. And it's becoming more and more normalized. And people are buying substances off of social media and off of the internet, of course. And so it's really created this whole entire platform of facilitating substance use and normalizing it, which has become extremely dangerous because the risks are not being shown firsthand. So when we talk about substances of concern, so this is for this, 12 to 18 age demographic, Delta 8 THC. So this is becoming more common, not super common, but it is a legal cannabis derivative sold in gas stations and convenience stores. There is minimal age verification. As we know, some people don't check IDs as much as they should. But regardless, people are getting a different form of THC. Our high potency vapes, I can all imagine that we all know how big of a problem that vaping is, especially for young people. I go and do these, like I said, do these presentations all over the state, and I will ask 6th graders, how many of you know another 6th grader who uses a vape or is addicted to vapes? And I would say probably like 75% of them will raise their hand. It's happening from a very, very young age. I got a call last year about a student who was picking up vapes on the side of the road that he would just find and would use it or hit it to try and get some nicotine in his body because he was so addicted. He was in high school, I believe. I think he was 14. And it was so sad to hear that kids are literally just picking them off the street because they're becoming so addicted to them. Not many kids know that the flavors and the designs and the marketing is directed towards young users. Not a lot of kids know that, there's so much nicotine in it, or even what nicotine is, what it does to your brain, and that it's basically equivalent to about 4 packs of cigarettes, but there's no studies on vapes because they're not federally mandated. They're not federally overseen like alcohol and whatnot. So the government has no say in what goes into these products, which also leads to chemicals and all these other things being put in it. So vapes, even THC vapes, very, very common. It's getting younger and younger, and people are just getting them from family members, friends, picking them up off the side of this road, which is what I heard, which I was surprised. But it really is like an epidemic within itself. And it's becoming really dangerous because not many of them know like the intense side effects that they could have. Skipping over to Kratom. Kratom is becoming more and more popular. If you have not learned about Kratom before, I highly encourage that you do. Michigan Open does a really good, Kratom 101 educational session like this where they talk about it in depth. But kratom is just a plant-based substance that acts as both a stimulant and it gives off like an opioid-like sedative. It's sold as powder, capsules, or teas in smoke shops or gas stations. You'll see like, their big neon lights will be like vapes and kratom. This is becoming more and more popular because it's giving 2 different types of effects. It's legal to buy over the age of 18. Also, for people who are maybe on like probation, it doesn't come up in a drug test. And so it is becoming more and more of a problem because people are becoming addicted to it. And then I actually heard of at our organization, we help people get into treatment every single day. And one of the participants relapsed on heroin because of kratom, because it was giving those opiate-like symptoms. So it is very dangerous. We could spend a whole hour talking about it, which I'm not going to do. So I really encourage a lot of you to do education if you're not familiar about it. Our pet press pills or counterfeit medication is becoming a very big problem for our young folks. So when kids are buying medication off of, Snapchat, off of TikTok or whatever, friends and family even, they may not know where it came from, and there's a really high risk that it has fentanyl in it. They look like regular prescription, medications. Most people don't know that there is fentanyl in it unless they test for it. And with this generation, we'll talk about, academic validation and the pressure to excel in sports in a little bit, but just know that a lot of kids are moving into press pills that are opposite than ever before, which we'll talk about. And then psychedelics, we're seeing a rise. This isn't too common for like the 12 to 18 age group, but usually the 18 to 24, which is our college age group. There's a big rise in LSD and mushrooms and DMT. This could be contributed to a lot of different things, but it is coming back. People look at it as it's safe because, mushrooms are natural. There's not much of a risk of overdosing and whatnot, but there's still a ton of dangers that are associated with it. But by far the most dangerous, and now the very, very popular nitrous oxide or whippets is becoming such a scary issue. As whippets are just a form of inhalant abuse. So you could say the spray that cleans your keyboard. People use that, or if anyone's been to Starbucks before and you see the whipped cream canisters where they add in like the pressurized nitrous oxide, and that's what makes like the whipped cream fluffy. People will buy those little canisters and huff those. It is causing severe brain and nerve damage. So over time, this nitrous oxide or whippets, it just puts holes in your brain essentially. And it's really scary because it could kill you instantly. People need a lot of it because the high is such a short amount of time. Usually it's about like 45 to 90 seconds that you feel it. And then usually someone passes out because it's a lack of oxygen to your brain. And so people need a lot of it. So they're using it, getting a little tiny high, either falling asleep or passing out, and then waking up and they don't have any type of high. So then they keep it going. This can't be tested on any type of drug panel. There are not a lot of treatment resources directly for whippets at this time. Wayne State is doing a huge campaign right now and has been for a while about the dangers of whippets because it is becoming such a problem, especially with this younger generation, because you can buy these canisters just from the gas station, just like anything else. And so they're very, very easy to access, and they have such a high potency and such a high risk for death. And it's really, really scary. So more emerging substances, these are not as common, but we are seeing a little bit of it. So lean or purple drink, which is just like coating cough syrup mixed with soda. This is really commonly glamorized. I like to say during like the Lil Wayne era, if like anyone remembers that time from like, what was that, like 2006 to like 2016 when Lil Wayne was super popular and he talked about lean a lot. And during that time, but now I guess it's coming back, which is shocking. I mean, I haven't heard any stories personally from like the Michigan schools, but national data says that it is becoming more and more popular because it is viewed as less dangerous since it's a medication. And then pink cocaine or 2C, which is it's known as, I feel so old like saying these like slang terms, but this has become popular ever since the One Direction member passed away last year. He was found to have pink cocaine on him, but it's not actually cocaine. It's a very dangerous mix of ketamine, MDMA, methamphetamine, and other substances. It appears as pink, but in reality, it's just a mix of really scary things. I actually had never heard of this until the member of One Direction had passed away, because that's like my era of music. And so I was really like looking into that case of like, oh my gosh, what had happened? I had assumed it was fentanyl. But at the time he was using pink cocaine. And so ever since then, it's been talked about a lot. It's been in the news a lot. There's been a lot of misinformation about it. So it is kind of on the rise. But like I said, personally, I've not heard of any kids in Michigan using either one of these substances. But it is worth doing some research on and knowing what they're made of, in case, you do hear patients or participants using them. So what makes living in the state of Michigan very difficult, especially, is the geographical variations that we see throughout the state. So each community has very different problems. So we have urban communities, we have rural communities, we have industrial areas, we have, even suburban areas where there may be different substances of use. So we see in our urban areas, there may be more synthetic drug access, there may be higher use of heroin at younger ages, pills may be more popular. But there's also more treatment facilities usually, and there's, usually more availability of help. But there are a wide variety of substances that are available. Our rural communities, we see that they also have a very high limited prevention resources. They tend to use alcohol or tobacco or prescription drugs. We see methamphetamines. It really ranges there on what's being used and what is socially normalized. And then our industrial areas, we have a lot of those in Michigan. So those can tend to be a combination of everything. There's a lot of families that are facing economic stress. There's a lot of, support networks as well. So, we are lucky that we live in a state where there's strong union support, and there's a lot of resources that are available. So it's something to consider when, especially, you are implementing prevention resources in your community. Just look at what is actually going on in your community. Listen to the students who are telling you what is happening, and then doing research and hopefully developing some educational material like this based on what is happening. In the state of Michigan, there's no good one-size-fits-all prevention resource. So this is what we do. We go and, talk to the principal, talk to the teachers about what experiences are you having, what are students using, what are you seeing as a community. And then we develop our educational materials by doing, very good research, coming up with good statistics and good facts, using, SAMHSA and any type of prevention materials, and presenting it to them so it's relevant to their community. Prevention is not a one-size-fits-all, and so we really have to be diligent about the way we approach these conversations based on, the cultural, socioeconomic impacts that community may have regarding substance use. So the adolescent brain development, I always feel like this is important to include, because this is what we teach to students. I'm going to teach it to you exactly the way that we teach it to students, because talking about what happens in your brain when you use substances is one of those key factors that they don't understand. And it's really important for them to know that substances literally rewire their brain. So I always say that you have two different portions of your brain. You have your prefrontal cortex, and then you have like your brainstem and whatnot that are deeply affected by substance use. So your prefrontal cortex is what helps you make smart decisions. And that usually isn't developed until you are at least like 25, 26 years old. And so when you put substances into your brain says, oh, I really like this. And it produces a chemical called dopamine. And that dopamine is what makes you happy. And then over time, more substances you put in your body, your brain says, oh, I really, really, really like this. And this is the only thing that makes me happy. And so your brain is going to slowly rewire, and it's going to make you feel like the only way that you could be happy is if you use drugs and alcohol. And when you stop using it, then you're not going to feel happy anymore, and you're going to feel really sick. You're going to be sad, you're going to have anxiety and whatnot. So that's why it's so difficult for people to stop using drugs. And that's why people become addicted to drugs, is because their brain decides if they are going to do it or not. And that's exactly the way that I explained it to kids. So that way they know that, yes, they make a choice to use substances, and their decision-making center of their brain isn't developed. So they may not make the best choice, But if they make that choice to use substances, their brain might say, "Ooh, I really like it," and then it's out of their hands. Their brain is going to take over, it's going to rewire, and it's going to make them extremely vulnerable for developing a substance use disorder. I also really drive home that the younger you use substances, the more likely you are to develop substance use disorder. And those prevention conversations can happen that easy. It doesn't have to be this big scientific drawn out explanation, but just making sure they understand, they know that their brain is going to rewire and it's going to become dependent on substances. So from our perspective as people who work in this field or people who may work with substances, we can see directly, usually really early, the impacts of substance use. So we have our cognitive effects. Obviously, it's going to make them have poor judgment. It also goes on to like poor coordination and memory. Really, really affects their ability to focus and learn. I see this especially with kids who are addicted to vaping, who can't sit still for a 45-minute class period, who can't finish an assignment because their brain is just telling them, I need this, I need this, I need this, I need this. And it makes them make bad decisions or, risky behaviors or risky decisions, if you will. So kids are more likely to engage in risky behaviors if they start using substances early, whether that is because of their brain changing or, they're just engaging in a new crowd that it may also engage in dangerous activities, but it can lead to a long-term pattern of poor decision making. So it's really important to address those behaviors very early and also talk about healthy decision making and smart decision making. That's a really important part of our prevention resources. So of course, our emotional issues, kids are kids. They have a lot of emotional instability, mood swings, irritability, whether, if you want to call it dysregulation because of puberty and all of the other factors. But when you throw in substance use to that, it can lead to, extreme mental health issues and big, big increases in emotional issues. So obviously it's one of those warning signs where parents are like, how do I tell if my kids are using substances? And I'm like, oh, a lot of it's behavioral, but also at the same time going through behavioral changes, and so we can't always assume that someone's using substances. Our academic impact. So, like I said, poor focus, kids are missing class, they're getting lower grades, they're at a higher risk for dropping out of school because of substance use at an early age. Career limitations and legal consequences they can go hand in hand. I talk about this a lot with kids as well. So, kids not knowing that they could get a misdemeanor or a couple civil infractions or a misdemeanor, depending on what the charge is. So if it's minor in possession of alcohol, if it's a minor in possession of a vape, if they get caught with marijuana, if they get caught with substances, that directly impacts their legal, criminal history, if you will, and that can block a lot of future opportunities. And one of the things that I always explain to them as well is that lead to career limitations. So if you're coming into your college, you haven't even gotten to college yet, or maybe you are in college and you're trying to make sure that you're going to set yourself up for a good career path. If you have any type of drug related charge, you're going to have to disclose that. You're going to have to disclose that on college applications. You're going to have to disclose that on any job application that you have for probably the rest of your life. It also can limit if you're applying for a social work license, if you're applying for a medical license, dental, any type of healthcare license as well, where you need to, register through the state. It could really affect the career that you may have, your prospective career, but also the career that you could have then. If you have a job, you could get fired from your job or whatnot. I was 14 years old when I started working. And so looking at, kids may already be working and it could be affecting their career in the long run, or, so I usually explain those hand in hand, and it really resonates with kids because they're not thinking about the legal consequences. They're not thinking about the career limitations 15 years down the road. And then our obvious health problems, substance use can increase the risk of accidents, injuries, brain damage, heart, liver, lung, reproductive system as well. We tend to talk about that a lot with kids, is that it can affect your reproductive system from a very, very young age. So if they want to have kids in the future, this could be detrimental to them. And also their immune system as well. So there's a lot that we can tell them about without, saying that if you use drugs, you're going to die. We're trying to move away from that model. We're trying to explain to them what are the risks that are associated with it, the cognitive, emotional, academic, career, legal, health. Um, it is really important to explain it in that way so they can sit there and digest that every one of their decisions that they make could lead to harm to themselves and to others. And so this is the way that we like to explain the risks of substance use. We're trying to move away from the fear mongering mindset because that does not work. So when we talk about warning signs, I mentioned this earlier, that there's a lot of behavioral stuff going on with kids when they are 12. I mean, I would like to say like 2 to 18. Um, every behavioral warning sign does not indicate substance use. I always like to say that if someone is displaying these types of behavioral signs, maybe it's our opportunity to check in with them that something is going on. It doesn't directly mean that they are using substances, because if I don't get like 8 hours of sleep, I'm going to be very irritable, maybe angry, and maybe be defensive. If I don't drink coffee in the morning, you get my point. So it's really important to really get down to the root of the problem, and not assume that someone is using substances because they are having warning signs. Simply, we just want to pay further attention and we want to have conversations with them. So, mood changes. If there's any secretive behaviors, so hiding possessions and, locking doors, kids want privacy. So, like I said, it's not always associated. When we talk about financial issues, there may be missing money, they may be selling possessions or be unable to explain where their money is going or what they're doing if you're giving them money. And then activity changes. So they're dropping long time interests or they're abandoning former friends. Good idea to check into them to see kind of what's going on. Obviously, we know that there's like a natural progression of getting new friends and meeting new people and whatnot, but we want to make sure we're checking in with our youth. So our physical warning signs, these are easier to spot. Obviously, they vary by substance and they don't always indicate substance use. We want to make sure that if anyone is, showing or exhibiting these signs, that we give them the attention that they may need. But of course, depending on whatever substances they may be using, bloodshot eyes and pupils tell us a lot. So whether they are super, super big or super, super small, that may be depending on substances that someone may be using. Frequent nosebleeds, very common for someone who is snorting any type of drug. Unexplained bruises or marks, once again, something we should just check in. Poor hygiene, that one's hit or miss because that can be contributed to depression or anxiety or also just kids being kids and being gross. So obviously just want to check in with them. Our physical symptoms, slurred speech, coordination problems, unusual sleep patterns. We see significant weight changes, usually weight loss, but it can be weight gain. And chronic cough or respiratory issues, very common for kids who are using vapes and smoking marijuana or smoking anything. A lot of coughing is what we see kind of right away, especially kids who are using vapes. So, are risk factors that make someone more likely to develop a substance use disorder? This is something I also talk with kids so that way they know. Early use, the younger you start using, the more likely you are to develop. Family history. That is one I always, always touch on with them, really hone in, is that if you have anyone in your biological family who's been addicted to substances, you are more likely to become addicted to substances yourself. Adverse childhood experiences can be a little difficult to explain to them, but it's something we do touch on because we want to make sure that kids are especially getting the help that they need. So trauma, abuse, neglect, household dysfunction, food insecurity, clothing insecurity, really anything that is outside of like our normal experiences. So independence seeking is one as well. Kids are trying to feel more mature. They're trying to become more independent. They may be doing this because they may see that they, can handle it or they're okay. Self-medicating, using anything to manage your emotional pain, to numb yourself, escape from academic and social pressure. A lot of times when we ask kids, why do you use substances? They say to escape. They have a lot going on in their life. So we may want to, push forward more holistic methods of coping, like journaling or seeing, a therapist or whatnot. And then mental health, of course, the chicken and the egg. So depression and anxiety increase substance use increases depression and anxiety and other mental health disorders. So it's really dangerous situation. And so we really want to drive home that if they are experiencing any type of mental health issue, that they should be seeking the appropriate help and not coping with substances. There are some external risk factors. Peers, of course, we know about peer pressure. I talk about peer pressure a lot with kids. There's a chronic need to fit in. And so you're doing what other people are doing, but also our family environment. So if someone in your family is using substances, it becomes your normal. And I always say, like, my experience growing up, my brother struggled with substances, and I didn't realize that other people didn't have like substance use in their home because that was my normal. And there was if someone has a lack of monitoring as well, their parents are working or, they're at home alone most of the time, that can also contribute to it as well. And that goes in with our community factor. So in some neighborhoods, it may be the norm to use certain substances. There's certain economic stresses. We're talking, you know, access as well. It may be very, very easy to get substances. And so with our family, like I said, our home availability. So if alcohol is out in the open, if it's not secured properly, prescriptions and cannabis products, vapes, most people get their substances, most kids, most get their substances from their family members, simply because it is not locked up properly. And I talked in depth about media exposure. So these are some things that outside of, we have to think about that are not directly related to the youth, but may also be an influence. I also like to touch on like our family aspect with our economic stress impact. Obviously, this is a stressful time for most people when we talk about the economy. I think back to 2008 when, my brother was in the height of his substance use and my dad worked in the audio industry and things were just kind of like falling apart, it felt like. And that's a lot of people are facing that right now. Family, financial pressure, and there are very unique stressors that affect youth when you come from a family where there's a lot of financial strain, reduced supervision. Families are working multiple jobs, long shifts just to meet ends meet. And that can lead into that emotional spillover. I feel like this picture on the left is a good example of what emotional spillover is when your parents are sitting at the table trying to figure out bills, trying to figure out how we're going to meet ends meet, just sitting there stressed, and that could be spilled over onto you as a child because you are like, oh my God, like, I don't know what to do, or whatever it may be. But it does impact youth a lot. And so this is a time that we should really be focusing on prevention and having these conversations because the economy is the economy right now. And it is, the family dynamic is having pressure on youth. So our protective factors, now that we got all the really, really sad stuff out of the way, our protective factors are what makes someone less likely to develop a substance use disorder. So things that really we can promote, that we can, try to encourage students to engage in, so that way they are not engaging in substances. So school engagement as a whole, whether that is, they're just attending school and doing their homework, they're engaging in class, they may be participating in school activities. That's really good for them. Having a positive peer group, also very good. Any type of extracurricular activities. So a kid who is engaged in extracurricular activities is less likely statistically to developing a substance use disorder. So whether that is whether that is sports, any type of hobbies, piano, music, anything really they like to do that is an organized activity outside of school, super good for them. Also having that community connection. Do they have people in their neighborhood that they can trust? Are they attending a church or a community group where they can, build a strong network of people that they can trust? Our trusted adult mentors is really important. So And from my experience growing up, it was important for me to have a trusted adult where I could talk to about what was going on in my home and the substance use, and it was outside of my family. So whenever I do my prevention presentations, I always encourage them to think in their head, who is their trusted adult? Is it a coach? Is it an aunt and uncle? Is it, a teacher? Someone who is older who they can go to about these problems, who will give them, good feedback and also hold them accountable outside of their family. And then lastly, strong family bonds. This one's tough because it's not possible for everyone. And so family can be whatever it means to you. I always say this could be your chosen family. It could be your friends who are just like best friends to you or family. Just someone that you can lean on in your life, whether it's a grandparent, aunt, uncle, or someone you choose who, a neighbor that you love. So having a trusted adult is very important. Sorry. So prevention, when we talk about prevention, it is really important to know what doesn't work. Um, the scare tactics of this is your brain on drugs, the Nancy Reagan, egg in a frying pan, the dare method, where you're just like, you're going to die if you use substances. It's very, very ineffective. And it is the dare generation, which I was a part of, it's kind of funny if you look at the data and if that increased substance use or not. People have a lot of various opinions on it. But a lot of people contribute that it did increase substance use because it didn't come with those making healthy decisions, understanding risk factors, knowing the dangers of substances, what they do to your brain, what happens to your brain when you're using substances, instead of, this is your brain on drugs, it looks like an egg in a frying pan, versus no, your brain actually rewires. So we want to stay away from those. It is really important that we stop saying all of that and we really move away from it because it's not effective and it's not helpful. One-time programs as well. So prevention is most effective when it's implemented at multiple stages. Typically those transitional ages. So, elementary school to middle school to high school to college. We want to have consistent messaging. Drugs change over time. And so we want to make sure that we're providing the right education about the trends that are happening and making sure that it's not just a one-time shot at like fifth grade, like what I got. Most kids aren't using drugs in fifth grade. Some may be using vapes, but we want to make sure we're having these conversations. And then lastly, we don't want to exaggerate, the overstating the risks or making it seem so much worse than it is. Really approaching it honest, fact-based. You want to maintain a credibility and really just showing it for what it is, doing our research as adults to have those honest and open conversations. We don't want to perpetuate stigma by, continuously telling this when they're not really debunked or they're not true fact. So what does work? Early interventions, of course. So starting prevention before substance use exposure, elementary school, middle school programs. Obviously, we're seeing kids in middle school who are using substances now. So we really, really want to focus on elementary school programs. There's not a lot of them. There's no national or federal mandate anymore after DARE. So there's no state mandate of prevention programs. So it is really important that we advocate for these types of programs in our community. Also parent and family involvement. So whenever I do our prevention, I always try to host a open parent night so they can come in and ask questions. And also so we can have those conversations with them. We want to continue we want them to continue the conversation at home. So we want them to have the facts, what's important when we talk about substance use. We also want to do skill building. So teaching refusal skills is a really important part of our prevention. I always say to kids, the earlier you learn to say no, the better off you're going to be your entire life. Because throughout our adulthood, we have to say no. So we talk about refusal skills as much as we talk about coping skills. We also want to give them emotional regulation tools and resources as well. So that way they know how to handle difficult situations. Of course, our education and awareness programs. Once again, falling into that prevention, but also our community collaboration. So families, schools, and community organizations would be working together to create a strong environment for young people. We want to reduce their substance use because it is starting at an earlier age. So there are some digital prevention tools, and this is really a great way to get in touch with those like actual trends that are happening right now. If kids are using substances and learning about them through social media, we should have social media resources that can help prevent their substance use. So there are support apps, like SAMSA has one. There are some health support applications. 988, our text and chat crisis line, super easy for someone to engage in if they have a cell phone. Parental monitoring is really important, and parents need to monitor their kids' technology. So there are some different tools and apps that they can install to make sure that they are monitoring their social media appropriately. And then also from our perspective as like adults and parents, learning digital literacy and teaching that to kids of critical evaluation, of understanding what is dangerous and what is not, and having those open conversation. Digital literacy is like kind of this newer thinking model of or practice model where you can, really digest like what is happening on our social media and how can we, evaluate it and think about what's good and what's bad. And so I always highly recommend our parents, learn about digital literacy. We hear a lot that older generations are like, oh, I have no clue how to use that app, or I have no clue how to engage in this. I don't even know what TikTok is, how to log in. And then their kids are using these types of, social media apps, and they have no idea how to like monitor it. To say all this, that technology can be both a risk and a protective factor. Kids can find these support apps that can be protective, but also can be a risk. We want to make sure that, social media and apps are being used appropriately, most importantly. So I always get this question when we talk about youth, and I think it's super important when we talk about creating an askable adult. Um, I like to bring this up because I don't think I ever had like an askable adult where I could openly talk about substance use and the dangers of it, because it was immediately assumed as like, you better not be using drugs. So we want to start avoiding that, and we want to create our askable adult. And so how we do that is we start early. Like I said, we have age appropriate conversations before exposure. Just like the way I talked about what happens to our brain when we use substances. It doesn't have to be scary. We don't have to avoid it. We can start having those conversations. And then once you start having those open conversations, you're going to build that trusted presence. You're going to become reliable to that child, and they're going to know that they can talk to you about it. But as a child grows up, you have to continue practicing your active listening skills. We have to hear their concerns without rushing to solutions, without being like, oh my God, they're using drugs, or this is really happening, which can be super scary when you have kids, or you're around children. But in reality, we need to listen to them, hear what they're saying. And that goes next to having our factual knowledge. We need to understand what's happening. We need to have our correct information. We need to know about substances, and we need to not fearmonger. And we also need compassionate boundaries. We can have these conversations with having appropriate limits and boundaries about what is acceptable, what's not, what we are going to talk about. Making sure we're honing in the conversation to be the facts and not letting it be all crazy. Mostly we want to avoid judgment. Creating safety for honest discussion is really, really big. Not be judgmental, because that's going to make someone not want to talk to you at all. And so just saying, okay, I appreciate you telling me this, instead of, oh God, I totally know they're using drugs, like for sure. And then lastly, we want to keep talking. So this conversation should keep happening. Like I said, prevention is most effective in multiple interventions. So it shouldn't just be a one-time talk, like the birds and the bees, we just talk about it once and then we kind of forget about it or whatnot. These conversations should be happening very frequently. And when you are an askable adult, it should happen naturally, because that child should be able to trust you. So it's just some tips and tricks of how do we start conversations with youth. So you could say, I'm curious about your thoughts on vaping. That is a little stale. So these are just general conversation starters, but make it comfortable for you. How would you talk to your family? What are the words that you would use? what have you heard about marijuana that maybe, another still one that doesn't work in your family, but you could say, do you know anyone who's smoking weed? If that's how you talk in your family. I care about your health and safety. Of course, I'm here to help and not punish is something we should always try to say. Let's figure this out together. And we want to completely avoid saying, did you do drugs? Tell me right now. Or I'll never trust you again if you don't tell me the truth in this moment. Or when I was your age, that's a really big one. Or you're throwing your life away, or you're just an addict like your uncle, or you're just an addict like your grandpa or your parents or someone in your family. That should not be thrown around at all. It's extremely stigmatizing, and that is going to destroy a person if you say that. And so we should really just be open, asking them questions about how they think, how they feel, versus us assuming that they are doing something. Uh, okay. So community resources to recommend. So we have our crisis lines like 988. We have the SAMHSA helpline. There's also local crisis response teams. If you have like a local crisis response team, I encourage you to put it in the chat and what area you serve, so that way we all can learn from each other and know how people can access mental health and substance use resources. If you need any type of treatment resources, FAN is a great resource for you. We help people get into treatment every single day, whether it is inpatient, outpatient, recovery support groups. There are plenty of other agencies around the state who do that as well. I encourage you to know those types of agencies and who to call. Super important. And then there's a lot of support groups. So if you are a family member affected, there's like Nar-Anon, Al-Anon, Families Anonymous. There's different online support groups. If you are a parent who is struggling with a child, we do family coaching and different things like that. So there is a lot of help, and a lot of people don't know where to go. There's a lot of shame that's associated with substance use, especially when it's young folks. So really promoting those types of resources is important. So just some additional support resources that are more statewide. Like I said, if you have your community resources, I encourage you to put it in the chat. FAN, my program, community education, we provide, statewide education, not just in the prevention lens, but also to, teachers, to social workers and doctors and lawyers and anyone who wants that type of education. MDHHS has prevention programs. They have funding available. They have data through, the MyFi, the MyFi questionnaire that is given at multiple age groups throughout middle school and elementary school. Michigan Prevention Network has a lot of local coalitions. There's usually a coalition in every community. So I encourage you all to, look up your local coalition and get connected with them, co-host events or whatnot. They're always looking for ways to expand this type of education. Okay to Say is a really awesome resource. If you aren't familiar, I highly encourage you to look it up. People can anonymously report substance use or any type of mental health concerns or, abuse, or if, child pornography even. There's a lot of different resources within Okay to Say. And then Michigan does have a crisis text line support network. I've never personally used it, but here is the number that is available. You can text it. And so that I usually put that in, my presentations for kids, so they know that they can talk to somebody confidentially, but not in their family. So once again, just a little about FAN. We provide evidence-based support. We do these types of educational series. We also have our family and individual-based programs. Everything is done in the community, and it's very comprehensive. So if you or anyone is struggling with substance use, feel free to reach out to us. Our prevention program is very, very important to us. So if you do not have the resources or the tools to provide your own in your community, if you go to our website, faceaddictionnow.org/education, you can fill out a request form, and we come and we provide education all across the state at any age group. Well, I say any, usually it's like 5th grade and above is what we try to recommend, just because we want to make sure that we're giving the best material possible to have these types of conversations. And we are happy to help in any way. Or if you need any type of brainstorming on how to integrate prevention resources or these community-based events into your community, there's a contact information on our website, and you can reach out and I can help you plan those types of things as well, because kids are engaging in some scary stuff nowadays. But what's important is that recovery is possible. There's a 75% recovery rate if someone has proper treatment and support. 90% quality of life improvement reported by youth in recovery. And there's a 60% family healing, strengthened relationship through the process of recovery. So it is really important that we do promote recovery resources as much as we promote prevention. If you do know a kid who's struggling, reach out to us. We will help them be placed in a treatment type of resource that is best for them, because it is super important and kids are struggling. We hear every day. I was doing a prevention presentation last year in a school in Detroit, and I had a 14-year-old tell me he was addicted to fentanyl. And by the end of that school day, we were able to help him get into a treatment center. So it's really just about having these conversations and why prevention programs are so important, because there's a lot going on. So early intervention works. We need to know the warning signs. We need to know when to act promptly. We need to know what substances are being used, and how dangerous they are. We need to have communication open and non-judgmental. It's really important. We need to know our support resources. This says union resources because I just did this presentation for the UAW, but regardless, support is available for anyone regardless of their financial status. Our agency works with anyone regardless of their insurance status, and all of our services are free. And most importantly, recovery is possible, and recovery is possible for youth who are struggling with substances. So that was a lot of information that I threw at all of you today. My contact information, if you need any type of guidance, resources, or you need any idea on how to move forward, how to integrate this into your community, feel free to reach out to me. And if you are interested in our further educational opportunities, you can go to our website and request that, and we can help you set that up. So I appreciate you all today. If anyone has any questions or anything, this would be the time. But if not, then we'll get you out of here a few minutes early.
I do see one question from Anne Marie. Sorry, I just lost it. Any suggestions on apps for parents, or is there a place that these can be found?
For here, let me go back and see. I don't have one off the top of my head, but I would say probably like the SAMHSA app is good. There's a lot of local. That's a really good question. And honestly, I would have to do more research before I recommended one, because I know there are a lot of these apps, and this presentation was geared towards more of like kids and what apps they could use. So I would have to do more research before I refer one to you, because I would not like to refer one to you that isn't the highest of quality. You trying to look it up right now. There's an app from SAMHSA called Talk They Hear. I think that was the one that I was thinking of. And that gives some advice on how to have those conversations and whatnot. That was one I was trying to think of. I couldn't think of the name. So it's called Talk They Hear. It's available on iPhone, Microsoft, Google Play, and you can get informed, be prepared, and take action is what they say. So I am funded under a SAMHSA grant, which is why I usually recommend them as well, because I know that their stuff is really great. So Talk They Hear is the one that I would probably start off with, and then there's different ones from there, but that would probably be the most reliable.
Also, Jonathan asked, are there any recommendations for DBT SUD centers or programs?
Oof. So Yes and a no. This is a really, really tricky question because there are a very, very limited amount of substance use resources throughout the state of Michigan. My one that I would recommend the most is inside of the Children's Hospital in Troy. They have an adolescent addiction center where they do therapy. The doctor there is incredible. They also do MAT for kids who are, using opioids or alcohol excessively and need that type of support. There, like I said, there's a very limited amount of substance use resources. There's a center in Grand Rapids, there's a center in the UP. But if you're on the east side, like I am, I would recommend that center in Troy above anything. They are incredible. I would have to think, let me search what the name of it is. Because I just met with the doctor. It's called Adolescent Addiction Recovery Center, or AARC. It's inside of the Children's Center or the Children's Hospital in Troy. So if you haven't looked at them before, I would highly recommend you do. Dr. LaCase is super awesome, and they do have a therapist on staff there as well.
We have another question from Barbara. How are families without insurance and who may not qualify for Medicaid paying for treatment?
Yeah, so at our agency, we work with anyone regardless of their insurance status. So we try and navigate what that is. I don't work in the call center myself, so I don't know the ins and outs of what that process is. But if you call our call center or if you go to our website and look at that information, they're able to help navigate treatment resources for someone who doesn't have insurance. We've placed 18,000 people into substance use resources since 2017. So if you call us, we can help work that out and get you placed into a facility that is best for you, regardless of your insurance status. Anyone else have any questions?
Sorry, I was just rechecking the chat to make sure.
Yeah, it's
I
not
didn't
coming up
miss
on my
something.
end, so I'm glad you're saying it.
There's just people on here mentioning that a lot of counties have the CCBHC grants, which
Yep.
will help with people with uninsured individuals. So I just wanted to mention that. And I
Mhm.
don't think there's any more questions. So
Great.
thank you so
Thank
much,
you so
Maddie,
much,
for
Dave.
being with us again today. And thank you everyone that joined. We hope you found the information valuable today with this session. We hope today's presentation is just one of many webinars being offered throughout September as part of our Recovery Summit. For details and registration for upcoming sessions, please visit our website at www.sccmh.org under the Events tab. Also, please keep an eye out for short survey in your email. Your input is vital and helping us continue to improve and shape future events. For those requesting McBath and peer certificates, they will be emailed out mid-October. If you're requesting social work CEs, your certificate will be emailed out to you after payment is received, if applicable. Thanks again for joining us today. Thank you, Maddie, for 3 sessions this summit. We appreciate that, and we look forward to seeing everyone next time.
Thank you.